Well, good evening, Mountain House High School and our whole high school AHANA. We're so glad that you're able to be with us tonight to go over some of the new protocols that have come out for our tracking and taking care of the COVID-19 pandemic here in the school district. Again, we're glad that you're able to be here with us tonight. At the end, there will be an opportunity for you to participate in some Q&A through the chat, either on Facebook Live or YouTube Live. And we will answer as many questions as we can tonight. But we wanted to make sure that all of you as a community had an opportunity to see the updated guidance that was given to us through the California Department of Public Health and the County Department of Public Health, whose guidance we follow throughout this pandemic. So we'll get started tonight. This, again, is being broadcast live on Facebook Live and YouTube Live. It will also be archived, so you'll be able to go back and watch any of this that you'd like to see to review any of the presentation or any of the Q&A that happens at the end of this presentation. The presentation tonight should be fairly short, as we do have just a few updates from the guidance, and then we'll open it up to questions. So first, we thank all of you for your patience as we navigate through this pandemic, and we thank the community, the staff, students, and parents are all doing their part to keep us as safe as possible. And as you know, the guidance that we give you today could change tomorrow as updated information comes from the State Department of Health and the County Department of Public Health. We do want you to know that regardless of what you hear from the CDC, which is our national government's health department, regardless of what comes from them or even from the state level, that we always wait for direction to come from our county health department through our school board, who makes the decisions for what goes on here in our district. And as soon as any of the guidance changes, we'll have another meeting and we'll make sure that we send out emails and communications so that everybody's on the same page about what's going on with the guidance that we've received and the protocols that we follow here at the high school. So tonight's agenda, there's just a few points that we're going to go through. You'll see them there: vaccination status, daily procedures that we follow, daily campus precautions, what happens in the event of a positive case of COVID, COVID exposure, masked versus unmasked, independent study, and how to report absences, and then a Q&A at the very end. So first, vaccination status. So if you have not already done so yet, we do ask you to email a copy of your child's vaccination card if they have been vaccinated to the attendance email, which is mhhsattendance@lammersvilleusd.net. That allows us, when we're contact tracing, to easily obtain in our own system whether the student is vaccinated or not. It's one less step for us in the contact tracing process. And it will also help us determine if your individual student needs to quarantine or not. So again, if your child is vaccinated, we do encourage you to report that to the school. We'll put that on their student record, just like all of their other vaccinations, and it makes it easy for us to look at. So let's go through the daily procedures that we're asking parents to follow, and the incidence of students and staff with symptoms and return to school after symptoms. So the first thing is, we do ask all families to screen your student before they come to school on a daily basis. The symptom screener is available on our website. If you go to information and you go to the COVID-19 guidance page, there is a symptom screener. I'll show you a screenshot of that in a second. But prior to coming campus in the morning, students and staff, we ask them to self-screen for a temperature that's 100.4 or higher, taken by the mouth, and then any new concerning symptoms that include these things that you see here: a sore throat, a loss of taste or smell, difficulty breathing, uncontrolled cough, diarrhea, vomiting, or abdominal pain, and any new onset of severe headache, especially if that comes with fever. So this might look a little a little familiar to you, this is our home screening tool that is on our website. That's the screenshot of what you'll see on our website. And you can use it at home on a daily basis, just making sure that you're checking with your child before they come to school. And our staff are asked to do the same thing on a daily basis and to not come to school if they have any of the symptoms below, and to contact the school site if you do. So again, I'm going to say it again. I know that that it sounds redundant, but we find that people are not necessarily sometimes following this. If you have any of those symptoms, we ask you not to send your student to school. Do not come to school. Contact the attendance office and make sure that they know what's going on. So for all COVID-19 related questions, you need to make sure to email us, not do the excusal form. The excusal form is not for COVID-related illness, and we'll cover that again at the end of this presentation. But for any COVID-19 related questions, we ask you to email. Again, we are experiencing a very high volume of calls if you're calling in, and so you may be waiting for quite some time. But again, if any of those symptoms are showing up, we ask you not to send your child to school, to keep them at home, and to email this email address. And our attendance secretaries are diligently checking those emails all day. You should, when you send an email, receive a confirmation email that comes to you so that you can see whether we have received it or not. But it may take us the day to make sure they're getting it. I do see questions coming in. We'll go to those questions at the end, but thank you so much. If you have questions, actually, you might want to hold your questions for a while. We may come to the answer to those questions before the end. But if you feel like you have a question and you'd like to ask it because you might forget, you can go ahead and type that in on the chat, either on Facebook Live or on YouTube Live. So what daily campus precautions are we taking? We know through the research that the way that this virus is spread is through droplets that are in the air. And so we ask that all students wear a face mask. We don't ask, we require that all students wear face masks at all times while inside buildings by both staff and students. You'll probably notice that today during your child's 5th period class that 3 masks were distributed to each child at the school. If you were unable to receive those masks today, either because your student was absent or because your student is an online student, you would like to obtain those, we will be doing a drive-through mask distribution tomorrow, starting at 3:50 in the front of the school. You just need to bring your student's ID with you, and we will give those 3 masks to you. They are N95 reusable masks. But we do have 3 for each student and each staff member on our campus that was sent to us by the County Department of Public Health. So during lunch and when eating food, obviously students need to take their masks off. We have asked teachers, sometimes teachers invite students into their classrooms to eat in the rooms, and we've asked teachers to not do that. They're much smaller environments where students are unmasked, and so we do ask that students eat in the larger areas. The NPR or outside is probably better to make sure that they are not getting unmasked contact. And then we ask that you, especially with high school, if your students are sitting somewhere with other students and eating, that they keep track of who they're eating with in case of an unmasked contact so that we can trace that if needed. Our lunch tables have been spaced as much as we can to allow for distancing, especially in the outdoor areas. So yeah, just make sure that when students are eating that they're not in small environments, that they're in more open areas where, and we do our air conditioning systems have been optimized to make sure that there's the maximum airflow going through those rooms. So what happens when somebody tests positive on our campus? And this is what we're going to go through: the contact tracing and the notifications that you're going to receive. So as soon as there is a positive case for COVID that has been reported to us, we do notify our student services department immediately. And we do maintain confidentiality as required by state and federal laws. So we do not tell other students who may have come in contact who it is. We just notify students that they have been exposed. Our district also notifies the San Joaquin County Department of Public Health, and we initiate contact tracing that we do here on the site. So we notify anyone determined to have any kind of close contact and advise of any required self-quarantine. And then we follow all additional public recommendations from the San Joaquin County Department of Public Health. And we'll go through what those requirements are. So here's the definition of a close contact. So a close contact is any individual who was within 6 feet of an infected person for at least 15 minutes within a 24-hour period, starting from 2 days before illness onset. So when it's reported to us, if a student reports that they are COVID positive, we go back 2 days before that COVID positive and notify any close contact, which is a person within 6 feet of an infected person for at least 15 minutes within 24-hour period. And we notify all of those people about their close contact. The contact tracing is pre-scripted. It is completed by student services and identifies the people that the infected person had close contact with in school, and any member of a classroom with COVID positive person is considered a close contact at this point. We also ask our teachers maintain seating charts, and we ask teachers for the seating chart so we can determine which students are the closest to that other student so that we can contact trace appropriately. So the student who reports that they are COVID positive, the new guidance is that they must stay home for at least 5 days. This is consistent with the new CDC guidance. Their isolation can only end after day 5 if there are no symptoms or the symptoms are resolving and that there is a negative COVID test on day 5. So that doesn't mean they get to come back on day 5. They can come back on day 6 if their symptoms are not present or are resolving and they have a negative test. If a fever is still present, then isolation should continue regardless of whether the test comes back negative or not. So we ask that if you are reporting a COVID positive test, that you write the student's name and date on the test stick itself and send a picture of the results to our attendance email address, mhhsattendance@lammersvilleusd.net. Self-swab testing with a school nurse is also available in our front office, but you do need to contact the front office to receive additional information about that. We do prefer that you do the home test and then send those results in. But if needed, you can call and we can schedule something for you to come in. So if a student chooses not to test during their 10-day isolation, they do need to maintain isolation until day 10. And this, again, is because it's being reported to the County Department of Public Health. It is a Department of Public Health's isolation of that person. If symptoms other than fever are not resolving, we ask that the student continue to isolate until symptoms are resolving or until after day 10. And it is suggested that even at home, that the student wear a well-fitting mask around others for a total of 10 days, especially in indoor settings. And there is a recommendation to isolate that person from other people who are COVID negative in the home as well. So let's go through a little bit about what happens when a student is exposed to COVID, but it's a masked exposure. So what the CDPH states is when both parties were wearing a mask in the indoor classroom setting, unvaccinated students who are close contacts, which are more than 15 minutes and over a 24-hour period within 6 feet, can undergo a modified 10-day quarantine. Again, these are mask to mask for unvaccinated close contacts. So That student could come to school and would be placed on a modified quarantine as long as they are maintain asymptomatic, that they continue to appropriately mask, and they will need to undergo twice weekly testing during that 10-day modified quarantine if they would like to maintain at school. So they will, during that modified quarantine time, students are not able to participate in extracurricular activities. They can only participate in in-person instruction. And they need to wear a mask both indoors and outdoors if they're, this is again for unvaccinated students who had an exposure that's a mask to mask exposure. They will have to wear a mask both indoors and outdoors. And they can return to extracurricular activity on day 8 if there's a verification of a negative COVID test collected on or after day 5. So if your student does not want to undergo that twice weekly testing, again, these are unvaccinated students who have exposure, they can decide to stay home and isolate and quarantine through day 10. Which means returning to school on day 11. And those are calendar days, not school days. So the earliest day your student can return would be on day 11. Again, this would all be spelled out in any kind of communication that would be sent to you. You would receive a letter with all of these instructions. So you won't need to remember it in your head. You will get it home if it is something that has happened. So what happens if there's an unmasked exposure? So students who experience an unmasked exposure are still required to quarantine for 10 days after their last exposure. So if the student remains asymptomatic and can provide a negative COVID test result on or after day 5, the student can return under a shortened quarantine, and that it would be day 8 that they could return under the shortened quarantine. So what about vaccinated individuals? So vaccinated persons who are exposed, many of you are in this situation where your student is fully vaccinated. And right now, the definition of fully vaccinated is the 2 shots, the 2-shot vaccination, or if it's the J&J vaccination, the 1 vaccination for that. But vaccinated persons with an exposure to someone with suspected or confirmed COVID-19 are not required to quarantine as long as they meet the criteria that they are fully vaccinated and they're asymptomatic. So lots of people have questions about what happens if the students here at Mountain House High School have younger siblings at Lammersville. So there are two different scenarios. If the younger sibling is not vaccinated, that younger sibling will need to stay home, and that unvaccinated younger sibling cannot begin their quarantine until 10 days. The 10 days of the high school student's quarantine is over. So potentially that student, unvaccinated younger sibling, or any other sibling who may be exposed, who is unvaccinated, would have to quarantine for the time period of the full quarantine of the high school student plus 10 days after that. Now, unless that student actually does come down and test positive, then you can start the quarantine if that unvaccinated person were to also test positive. So again, if there are younger siblings in the district who are not vaccinated, that quarantine could be fairly lengthy if you have a high school student who tests positive and they're at home with a younger sibling who is not vaccinated. So students are, and that's because students can be exposed during the full quarantine time of that other student. And again, I see a couple questions coming in. We will be getting to those questions at the end. Okay, so there's a lot of question about while my student is on quarantine, what do I do? A lot of times people get COVID and they're not all that sick and they want to stay up with their studies, and we would like them to as well. We don't want them to fall behind. So in order for students to not have a negative impact on their attendance record or in their grades, students will be placed on an independent study, a special independent study contract. So what is happening here at the high school, and I can't speak what's going on at the elementary schools, but at the high school, all of our face-to-face classes have all of the assignments uploaded daily on Canvas for the student to complete. So teachers will upload those, and students on quarantine will be able to go into Canvas and just on a daily basis complete those assignments that they're being asked to do. And that will be a part of the master agreement that will actually get sent to you. You'll have it sent. It'll say that they need to complete their daily assignments on Canvas. We can sign that, and then the student attendance will reflect that they're on a short-term independent study. We're able to make sure that they get that work done, turn it in, and it will not impact their grade. So what about reporting absences at the high school? So there are 3 ways to report absences, and these are actually in the order of preference for us here at the high school. Because we are receiving a high volume of phone calls, it becomes very difficult for our attendance staff to process those one-on-one phone calls. So what we ask you to do first is to email the attendance office to report your absence. And that email has been shown a number of times as mhhsattendance@lammersvilleusd.net, and there is a link on our website. The second is if it is not COVID related and you would like to fill out an excusal form, that link is also on the website, but please non-COVID absences only. And the third and final way that you can get an absence excused is to call the attendance office. This is probably the slowest way to do it. We also ask that if you're reporting it either through email or it's a non-COVID thing and you're reporting it through the excusal form, that you don't report it multiple times. That messes up the whole process, and it's difficult for our attendance staff to wade through all of those multiple reports. So best way really is email the attendance office at mhhs@lammersvilleusd.net. That will go through and you'll get a confirmation email stating that we've received the information and we will get to working on it. If we have any questions or you have any questions, you can indicate that in the email, and they'll go ahead and give you a call to answer any of those questions. So that is all of the information we have to present tonight. We're going to go to the questions and take a look at, let's see. I have somebody in the background here helping me with the questions. So the first question is, how do you address those students who are COVID positive but asymptomatic and spreading it to others? We continue to use our mask policy. So yes, we continue to use our mask policy. We do contact tracing, and we follow up with impacted individuals. If they're COVID positive and they've reported it, even though they're asymptomatic, we would have them quarantine at home. We do not allow COVID positive, whether it's symptomatic or asymptomatic, doesn't matter. If they're COVID positive, then they stay home. And we ask you as families that if you have a child who has tested positive and who is asymptomatic, please don't send them to school. It does not help. That is for sure. So the second question, who determines and verifies a mask-to-mask exposure? So we determine the mask-to-mask exposure. The only time that there is an unmasked exposure typically is when a student is eating lunch. So that's when we go back and we ask the student during the contact tracing, who were you sitting with at lunchtime? Was your mask off during that time? And then we go from there. And then we determine who the contact is, when it occurred, and make sure that the appropriate things happen there. So what if a student still tests positive on day 11 and has mild symptoms? Can they get excused time after day 10? So the answer to that is the current direction from the CDPH is, as long as there is no fever and the symptoms are going away, then the student can the symptoms are resolving. The student can come back as long as there is no fever present. If there is fever present, then the student needs to stay home. Again, we're encouraging good mask usage, making sure that we're, separating students as much as possible. But yes, if the CDPH and the County Department of Public Health has said as long as there is no fever and the symptoms are resolving, they can come back to school. If symptoms other than fever are not resolving, so if symptoms other than fever are not resolving, then you would also continue to isolate. So if you're at day 10 and they're not resolving, then you would report that to the attendance office. Hey, I was COVID positive. I finished my 10 days, but I'm still feeling sick. They're not resolving. Then we will extend that, and independent study can be extended as well. So they're asking about tests during independent study. Can that be done? Teachers are actually working with students. We're not doing any kind of big assessments over independent study. Any kind of tests that will happen will be rescheduled, and students will not be penalized for missing those. Does contact tracing include lunchtime tracing? Absolutely. When the district or somebody from the school calls you to do the contact tracing, what will happen is they will ask the student, who were you sitting with at lunchtime? And then those students will then be notified, because likely at lunchtime, those are unmasked contacts. So the next is, if exposed to COVID and quarantining for 10 days, do we need to report absences daily? So no, the answer is no. Once you've reported it, we will automatically put you out on the 10-day quarantine. It will be noticed in your attendance. We will send that independent study paperwork home to sign. We log and trace the attendance office. Will update the attendance record, and you don't need to report absences for all 10 days. But when in doubt, if you feel like you're getting emails and it says that your student was absent still, go ahead and report it on the email again. If you're concerned, go ahead and do that. But if you've reported the COVID positive to us, it will be taken care of. Again, we are receiving a lot of calls right now, and our attendance office is working as quickly as we can. And sometimes we don't get to clearing all of the absences by the end of the day. This is a great question, and this is not really what this meeting is for. But the question is, do you see us going back to online schooling? It just seems like a lot of school missed with the potential exposures and require quarantine. And we're worried about the quality of education. So no, we're not planning on going back to online schooling at this point. We actually saw a really big spike in the last week and a half. And as people are coming off of their 10-day quarantine and coming back to school, we've seen quite a few students, quite a few teachers back on campus, getting over this newest strain. What I'll tell you right now, as far as the quality of education, we are doing everything that we can to ensure that we do have quality education. Part of that is through our Canvas, making sure that all the assignments are on there. If your student is an online student, making sure they're keeping up with their Edgenuity. But at this time, the CDPH is giving us this guidance so that we can keep school open and make sure that kids get everything that they can get while they're here. As you know, from the last couple of years during distance learning, it was sometimes lacking with the ability to do a lot of things that we would like to do. And we would much rather have our students here on campus, supporting them both academically and social emotionally here. Let's see. After sending an email to attendance, if symptoms are there, are we required to get a doctor's note? No. No. Don't worry about that. If you say your kid's sick, we're going to believe you. We're not going all out making you go get a doctor's note or anything like that. If you're ending your 10-day quarantine and your child is still sick, just tell us they're still sick and they can't come back, and we're going to take care of that. I saw that another question came through about hybrid. We're not really entertaining questions like that tonight because it's not something that we're even able to do. It's the legislature a year and a half ago when we went to distance learning made a lot of changes in the laws for us to be able to go to distance learning. And those temporary changes in the law are no longer available to us. And so we are not entertaining going to any kind of hybrid model. We don't have the ability to do that. And with our Canvas learning management system and the ability to kind of keep touch with kids, our teachers understand that they've got a number of kids out on any day, a given day, and we're going to make accommodations for those kids to be able to continue moving forward in the curriculum. All right. Well, it seems like the questions have slowed down. We thank you so much for coming tonight. We will continue to update you as we move forward. And as we get any kind of new news from the Department of Public Health at the county level, again, remember what you hear on the news through CDC and even the state. We wait for direction to come from our county office of public health before our board makes any kind of decision. We will post this on our website in the COVID-19 site. We do really appreciate you coming tonight. Tell your friends if they weren't able to see it that it will be posted on our COVID-19 website. It's also on our YouTube channel, our school YouTube channel. It will be archived there and anybody can come back and take a look at it. And we do really appreciate you coming and taking time this evening and have a great